Okay, this is part 2 of my labor and delivery story. And that was, the other video was only like 8 minutes long, so sorry. Okay. So they checked me. I was only 3 centimeters, 90% effaced. My doctor wasn't there yet, but she was on her way. They called her, and the nurse said that, you know, she'd be in with me shortly, and it was about, you know, because we got there at 2 o'clock in the morning, Thursday morning, and my doctor didn't get there till around 3:30 or 4 in the morning, and she came in, and my contractions were horrible. I mean, I was just fighting back tears. I mean, fighting back, you know, pain. And she checked me, and I was 4 centimeters, only 4 centimeters and 90% effaced. So, decided to let me stay, you know, because I thought I would have to go back home because I'm not dilated enough. But, you know, my contractions were so close together, you know, they were just like, you know, you're staying. So, I got to stay, and they came in, and they put an IV in me, you know, so I wouldn't get dehydrated, because at the hospital you can't have anything to eat or drink. You can only have ice chips at the hospital that I was at. And we have a really nice hospital here, you know. I mean, the labor and delivery room was like luxurious. It had like a big TV, you know, huge cabinets, big cabinets behind me, a nice bed, you know, a little recliner thing for my husband, which he didn't sleep in it because he couldn't while we were in the labor and delivery room. But so she was like, "Oh, I hope I get to deliver you today before I have to leave," because she was leaving at 9 o'clock in the morning on Thursday. And she's like, "Well, I hope that you make some progress before I have to leave, because I'd really like to deliver you." And I really wanted her to deliver me. You know, I didn't want some other strange doctor to deliver me. But then she said, if not, the doctor that's on call for me is Dr. Briones. And I was like, "Really?" Because I know her. So that was just a blessing, because I went and got an ultrasound from her at 28 weeks. She was the one that did my 3D ultrasound. And she's so nice, just as nice as my OB. So that was cool, that at least that, you know, I would know her. So then I didn't really care. So what happened was just kind of like a waiting game. They put me on Pitocin to help speed up my dilation and everything, and the IV didn't hurt at all, because she put some numbing cream on my hand. It didn't hurt at all, just maybe like a little prick, but I couldn't feel anything. It was just annoying having like an IV and wires hanging out of you. And I kept holding it out and everything. But once I got to 5 centimeters, I was still 90% effaced. I couldn't take it anymore. I was, you know, my contractions were 1 to 2 minutes apart now, you know, not 3 to 4 anymore. And they were lasting a minute long, and I would just sit there and go like that, because they would hurt so bad. I mean, I even cried during one of them, because it was just really, really intense. I couldn't talk through them. So at that time, I asked for the epidural. I mean, I was trying not to want to get it, but I mean, I don't see how you couldn't. Like, for me, I couldn't, you know. So I called for the epidural, and I got the epidural around 6 or 7 in the morning. You know, my mind's a blur with this, but, you know, they came in, they numbed my back a little bit. Did not hurt at all. I thought it was going to be really painful. It was just kind of like a little prick and like a burning sensation. It went up my back and then down my back. And then I felt like a cool sensation run up my back and then down my back and then down my legs. It was just a weird, weird, weird feeling. And then the people that I had and all the nurses that I had were so nice, made me feel so comfortable and everything, which was the greatest thing ever. Because that's what I was dreading, is getting mean nurses and stuff. But I had really, really awesome nurses. And the anesthesiologists were really, really nice. The ones that put the epidural in. And the epidural took about 20 minutes to kick in, and my legs felt weird. I mean, they just felt so weird. Like, I couldn't move them. Like, they were like Jell-O, and they were really, really warm. And you could pinch me, and I could feel the pressure, but I couldn't feel the pain of it, you know. Sorry. Hold on, let me look at my time again. Sorry, I know that's probably annoying. she's asleep right now, and she's in her swing. I have to put her in her swing whenever I want to make a video because she won't stay really calm anywhere else. And let's see, where was I? Oh yeah, the epidural. And then I couldn't feel contractions anymore. It was so weird. It was like my husband was looking over and he was like, "You're having a contraction right now." And I was like, "I am," you know. I couldn't feel them at all. I mean, the epidural was like, whew, it was just a relief, you know. But yeah. But the thing that annoyed me was having all these wires sticking out of me, you know, one in my back and then two in my hands, and then they put a catheter in me because once you have the epidural and all that stuff, you can't get up. Like, I couldn't imagine walking with that, you know. So yeah, I was having all these wires stick out of me, and then they put an internal monitor in me to monitor my contractions. And around 7, 8 o'clock, they came in and checked me. I was 6 centimeters dilated, still 90% effaced. So here we are, just a waiting game, sitting in bed, waiting. And around, I don't know, 9, 10 o'clock, I was around 7 centimeters, still 90% effaced. Then around 11, 8 centimeters, I was dilating every single hour, 8 centimeters. 12, noon, I was around 9 centimeters, and then around 1:30, I was 10 centimeters. So I was really excited about that, and I was 100% thinned out. And with the epidural, I could feel her head, like, coming down, but I couldn't feel the pain of it, you know. But I could feel, like, this pressure, and I was saying, oh my goodness, you know, I gotta push. I have this huge urge to push. And they were saying, well, you gotta wait. And I don't know, it just seems like when you want to push, you should push. But they kept telling me to wait. And around 1:45, they said, okay, it's time to start pushing. So the doctor came in, the OB, Briones, she came in, and I had to get up in these stirrups, as weird as it felt and everything, and pull my knees towards my chest, and bear down like this and push. And let me tell you, the pushing is really, really hard, especially when you can't feel what's going on, and you push and you push and you push. And then I had three nurses in the room. My husband was up here. Let me check the time again, sorry. Okay. My husband was up here, there was a nurse here, the doctor here, another nurse here, and another nurse here. And this nurse was saying, harder, push your chin down, But the doctor was saying, you're doing a great job, just keep doing what you're doing. And the other nurse was like, hold your legs up higher. And the other one was saying, you're doing good. And I was just like so confused. I was like, who do I listen to? But I just had to focus on the doctor because she was the one delivering. She knew what she was doing. And they kept saying, I'm seeing lots of hair. And they make you push 3 times during a contraction. And 10 seconds each whenever you're pushing, 10 seconds. And it really is hard, when you have an epidural. And I'm sure it's way harder if you don't have an epidural. But it takes a lot out of you because once you're done with one push, you lay back and you're like, whew, and then you hold your breath again and you push for 10 seconds. I mean, it's really hard. And as the baby was coming out, she decided to give me an episiotomy, which is a cut. She cut me, and my husband said, oh wow, I hope you didn't see that, which I didn't see it, but he said whenever she cut, blood just went everywhere, and it squirted all over the doctor, her clothes and everything. I was just so concentrated on pushing, and I only had like 20 minutes of pushing, so I didn't have a lot of pushing, which was good. Once her head came out, her whole body just went boom, and the doctor caught her and everything. And right when she came out, I heard her scream and cry, and me and my husband just looked at each other, and we started crying. And they took her over to the nurse station and everything, and I looked at her, and I was like, she's so cute, she is so beautiful. And we were just crying, and I just couldn't believe it, It just still wasn't real to me, even though I was pregnant, I mean, I don't know, it was just awesome, just seeing her, just seeing the baby, that she was inside of me. I mean, how real was it? It it was just a surreal experience. I mean, any of you that have ever gone through it and any of you that are getting ready to go through it, it's just awesome. There's nothing like it, you know, giving birth, and I would do it over and over again, take all the pain over and over again, you know. And then they took her, they gave her to me, let me nurse her, get the colostrum and everything that she needed. And they took her back to the nursery to weigh her and everything. And they told us that she weighed 8 pounds, 2 ounces. And we couldn't believe that. We were like, wow, you know, we thought around 7 pounds, but she was a healthy baby. She came out really, really pink, lots of hair, lots of dark hair. Let me check the time again. I know this is annoying. Okay. Now I have to make a part 3.